Good afternoon and welcome to today's webinar. Thank you for joining us. My name is Melinda Garcia and I am the Manager of Adolescent Immunization Initiatives for the Partnership for Maternal and Child Health of Northern New Jersey, which is providing today's program. Our webinar today is titled Women's Health, Health Disparities, Cancer Prevention, Cervical Cancer. I would like to review some information before we get started. The planners and speakers for today's program have no conflicts of interest to report and there's no commercial support for this activity. Immediately after the webinar ends, as well as in an email, you will be invited to take a post-program evaluation. We appreciate your feedback. Please complete the survey. To receive a certificate of completion, including 1 nursing contact hour, you must log in, listen to the entire webinar, and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. The program is being recorded and will be available on the partnership's website on the YouTube channel until September 22nd, 2023. We will be muting all attendees' microphones during the presentation, but we would love to hear from you. Please write questions in the question box and the speaker will respond to as many as possible at the conclusion of the presentation. Now, I would like to introduce today's speaker, Tamika Felder. Cancer survivor and award-winning women's health advocate, Tamika Felder is the chief visionary at Cervivor, with a C, a nonprofit dedicated to cervical cancer advocacy and support. Named a, quote, cancer rebel by Newsweek in the 2017 cover story, Tamika is a highly sought after speaker on cervical cancer advocacy, cancer prevention, HPV education, and living life with purpose after cancer. She is the author of Seriously, What Are You Waiting For? 13 Actions to Ignite Your Life and Achieve the Ultimate Comeback. Tamika currently serves on the steering committee of the National HPV Vaccination Roundtable. She shared her story and experiences on presidential cancer panels convened by the White House. An award-winning television producer, Tamika is currently filming a documentary about cervical cancer, the women living with it, and the vaccine to prevent it. Her story of patient to advocate, survivor to survivor inspires and mentors not only patients and medical communities, but anyone who has struggled with obstacles in their life. And without further ado, Tamika, you may begin.
Thank you so much, Melinda, for having me. I want to thank you and everyone at the partnership. It's an honor to be able to share my story because I know not everyone gets the opportunity to do that. In 2001, at the age of 25, I was working as a television producer and I was literally crossing off something that I had prayed about, hoped, wished, and dreamed about. When I look back at my diary that I still have to this day, my childhood diary with the unicorn on it, it was beautiful to be able to accomplish a goal that I had in my life. And I was living my dream out loud. And then at 25, everything changed. I remember thinking, 25 is so good. I want to stay 25 forever. Not knowing that I was putting out into the world that I might have just stayed 25 forever. Working as a broadcast producer, I didn't have a job with insurance. Many jobs were freelance. Many of you may know about consulting work, and it also often does not come with health benefits. And at 25, I can say it wasn't something that I was worried about. I didn't give 2 thoughts. Because I was 25, I was young, I was invincible. What did I have to worry about? Well, at 46 years of age now, I know otherwise, but back then in 2001 at the age of 25, I didn't see it that way. So after dealing with a boil under my arm for months, it would come and it would get a little better and then it would get worse. I finally went to an emergency outpatient facility and they said it was a boil, basically acne, a hair bump gone wrong, and they dealt with it. And the doctor asked some simple questions while going through my chart. When was your last this? When was your last physical? When was your last that? And I had to think about it. And I said, ooh, maybe 3, 4 years. And I was starting a new job in a week that offered health benefits. And the doctor said, well, you need to make sure that you're on top of these things. And one of them was getting screened for cervical cancer. I didn't know that at the time. I knew that women were supposed to get a yearly exam, but I didn't know exactly for what. I'm not stupid. I'm a smart person, but it wasn't one of the things that I really knew about. So I started my job, got the health benefits, and when I went to this doctor, I didn't think anything other than they're going to tell me to lose weight, which I still need to do. And I have dropped 40 pounds recently. So it's taken almost 2 decades, but I've gotten my act together. But back then I thought, this is what this doctor is going to tell me. So this doctor, because they didn't have any of my prior medical records, they said, we want you to come back in 2 weeks so we can go over everything. And we did just that. I was a busy television producer. I didn't feel like going back in 2 weeks, but this was a doctor that wasn't meant to be played with. And so I followed her rules and I went back in 2 weeks. And when I went back, she went through a series of things. Know this, know that, know this. And I remember thinking, cool, I'm about to grab my bag and I'm going to leave. And she said, now let's talk about your Pap. And it was like something that you see out of a movie, a television show, where you have this out-of-body experience and you're watching everything play out right in front of you. And that began my journey with cervical cancer. It began almost daily hearing the words cervical cancer, something in my 25-year existence I had never talked about, and now it was a part of my daily conversation. I was a scared 25-year-old. You know, when you're 25, you think you've got it all together. You're grown, right? And I realized I was just a scared girl who didn't want to die. A lot of times when people think about cervical cancer, at least I've heard it that way, they think cervical cancer is an easy cancer. You just have some cells removed, have a hysterectomy, and it's over and it's done. I wish that were the case. It doesn't matter if you're stage 0 or stage 4. Hearing the words "you have cancer" is devastating. It causes you to think, am I going to die? Is this going to be it? Is this how my story is going to end? I wasn't ready for my story to end. I still had more things to do. So June 14th, 2001, very early in the morning, I walked myself into the operating room and I had a radical hysterectomy and it changed my life forever. It took from me at the time what I thought that made me a woman. It took from me what I thought would be the reason why no one would want to marry me. It took from me the reasons that I thought I would never be able to accomplish any other dream because cancer had taken so much from me. I followed that radical hysterectomy with chemotherapy, radiation therapy, and many, many years of trying to put the pieces back together. And I'm blessed. I am honored to still be here, but I was called to do something. You know, a lot of times when you go through an experience, you're called to do something, to be involved in some type of way. And if you're not, that's okay too. I was back at my job, sitting in my newsroom, trying to do the things that I typically would do, and I couldn't do it. I couldn't move forward. I couldn't move backwards. I was just stuck in limbo. And I was angry. I didn't understand how this happened to me. I didn't understand how cervical cancer came in and changed my life so drastically. And so I wanted more information. I wanted to know more. And so as I began, you know, becoming an expert, at the time, I wasn't thinking of it in that way. I wanted to know how this happened to me. I asked questions, I researched, and I built a community. I wanted to find other people like me who had experienced cervical cancer. And when I did, no one wanted to talk about it. And why would we want to talk about something like this, something so devastating? But I kept talking. I couldn't hush up. I couldn't stop. I had to talk about what happened to me, why I lost my fertility at the age of 25. And along the way, I met so many people who wanted to share their story with me, but not publicly. I diagnosed in 2001, started sharing my story in 2003, and started my nonprofit organization in 2005. And what I know now, so many years later, is that when I started this organization, it was absolutely so I wouldn't be alone. But it's also because I started what I wish I had: community, information sharing, resources. when you are blessed to have a great experience, because not everyone receives equal treatment and equal access to care. And I was one of those individuals, despite being underinsured and at one time not being insured, had excellent access to care. And not just from my oncologist, but my nursing team, social workers, everyone provided me excellent care. And care definitely matters. I want everyone to experience that. And so when talking to other people and finding out about their treatment, their care, and their experience with cervical cancer, I wanted to be a part of the change that made that experience better. I also wanted to help so that no one would have to endure what I went through, especially people who look like me, who die alarmingly at a rate of 2 times more than our white counterparts. Health disparities are something that I wish didn't exist, but unfortunately they do. You know, when I talk about sharing my story and when I talk to parents on why they should protect their children from not only cervical cancer, but other HPV-related cancers, there's so much resistance. And then I remind them of my story. I remind them of, I wasn't a bad person. I wasn't doing anything that I shouldn't have been. I just was unlucky. That's the truth of the matter. I was unlucky. You know, today is an interesting day. This woman, Lisa Moore, it's her birthday. And it's a video that I wanted to share with you today, but we'll be emailing that video. Another young woman who died of cervical cancer, and being vaccinated would have saved her life. I know that the reason that I am making my survivorship count is because I'm blessed and honored to be able to share my story. I'm honored to be able to wake up and breathe and enjoy this day, even if it's a rough day. Today started and it was thundering and raining and gray and cloudy, but I got to experience it. I got to experience the sun following up behind it. I know that there are many people out there who won't ever experience that again because of a preventable cancer. When I was diagnosed, I didn't know that cervical cancer was preventable, but I know now. And I've made it my life's mission to do something about it, to be a part of the change makers. There's so many wonderful people working to do amazing things to protect people, to make sure that they don't have to endure a cancer diagnosis, that they don't have to worry about not only a reoccurrence, but a terminal illness. And it's because of wonderful people like you. What I want people to know that behind everything you do, and you know this, but there is a human being, there is a person who is depending on you. There are people who need to be educated about the resources and tools that we have to make a difference in the cancer space. There's so many cancers that we can't do anything about, but cervical cancer, we can do something about. You know, during this season, this month of Gynecologic Cancer Awareness Month, there are plenty of things that we need to spread awareness about. But one of the things that I also like to share is we have diagnostic tools for cervical cancers. We don't have those for other gynecologic cancers, and it's unfortunate. But because we do have them for cervical cancer, we need to make sure that these are utilized, because screening is a very important part of the equation for moms, for anyone who has a cervix. And so my story is, don't be like me. Don't be like me. If you're getting screened, it can be caught early. And I remind people that catching my cancer early meant that I gave up my womb. And it changed my life forever. You know, I would be lying if I said I don't mourn for the child that I wish I could have had. At 46, I know that there are other ways for me to be a mom, but my fertility was taken away from me at 25 because of cervical cancer. And I want to prevent that from happening to any other woman, young woman or older woman, any woman, women that look like me. You know, when we look at Black women and Latinas and the mortality rates, we have to change those. Part of the work that I do is to support what you do by getting patients to speak out about it. Unlike other cancers, I wasn't seeing that patients were sharing their stories, mainly because of the stigma of HPV. And so I've worked to shift that narrative, working with patients to teach them how to share their story, to show them how to learn the basics about HPV and cervical cancer and educate where they can. That means if they're educating, at their church, in their community, or just with their family and friends. We have been big proponents of making sure that people get screened for breast cancer. And I know it's taken time to get there, but we have to do the other things when it comes to cervical cancer, making sure that those who are eligible for screening get screened, but those who can get vaccinated. And it takes all of us to do that part. We're each a part of that equation. And so patient advocates are powerful tools, powerful storytellers to not only empower other patients, but the general public. And so when I share my story, I'm not sharing my story just for me. I'm sharing my story for people like Lisa Moore. I'm sharing my story for people like Erica Stum, Fraser. I'm sharing my story for people like Tialita. I'm sharing my story for people like Jillian. I'm sharing my story for so many people who are unable to share their story. And I want you all to be empowered to know that you are making a difference in the lives of people. You're saving lives. And I think when you work in a space where there is so much opposition, it is hard at times to feel like the needle is moving, but the needle is moving. When I first came into this world diagnosed with cervical cancer, I hardly heard anyone talking about it. Now, lots of people talk about cervical cancer. Sometimes they get it wrong, and that's the problem with social media. Social media is a powerful tool because we can disseminate information instantly anywhere, but it's also why it can be a bad tool. And so part of the work that we do as patient advocates is making sure that we're always giving information from credible sources, that we're doing our due diligence to make sure that we're sharing information, that we're partnering with wonderful organizations and making sure that we're doing our due diligence to get that information out there. And, when we have patients telling their stories, it's powerful because it brings the science to life. It makes people understand that cervical cancer isn't an easy cancer. It's a cancer that you can still die of. That alone makes it not an easy cancer. And so we want to make sure that people know the risks. They know that a diagnosis of cervical cancer, especially if it's not caught early, can lead to death. And we want to change that. We want to shift the narrative. We want to help get people screened and vaccinated because we know that we can make a difference. Cervical cancer is something that I live with every single day. Even though I survived it, I can't go without thinking about it. It doesn't hold me hostage anymore, but it's impacted my life in a way that I can't not think about it. When I wake up, I see a scar that will never go away. I know that I've been healed from the cancer, but it's left a trail with its secondary issues, whether it's lymphedema, bone loss, things that I have to deal with, menopause at an early age. But I'm alive. I survived it. I made it. And so I will make my survivorship count. I will do my part to end cervical cancer. I will do my part to make sure that, you know, everyone within the sound of my voice knows that they should be vaccinated against HPV, because we know it's the main cause of cervical cancer. I vow to make that a part of my mission until the day that I die. Surviving cervical cancer woke me up in a way. It reminded me that life comes with an expiration date, and that while I am here, not only will I make my survivorship count, I will make my time here count. I am, you know, so grateful, just thankful for you all for allowing me to share my story today, to talk about those who have experienced cervical cancer, and to really, you know, understand that this cancer is something that we have to close the health disparity gap. It needs to be done across the board for all cancers, but especially cervical cancer, because we can do something right now about it. You know, when Tialita Rickenbacker passed away before her 40th birthday of cervical cancer, it just reminded me that, you know, we're not done yet. We're not there yet where this cancer has been eliminated, and it's still so much work to do. It pains my heart knowing that, you know, there are people who still aren't getting screened. And because of this global pandemic, we know that screening has been at an all-time low. And so right now, you know, we're trying to get people screened, and we're sharing stories, and we're encouraging them to reach out and schedule those appointments, because we want to save lives. We want people to get vaccinated. And when we look at those mortality rates, and then we compare that with health disparities, we see where the work needs to be done. And we need to continue that work. And I want to encourage you to continue that work. I want to encourage you to be that change that you want to see. When we share our stories, we always share factual information. And I want to challenge you to go on our website and look at those stories. And I want to thank you for the work that you're doing to make a difference. And you are making a difference. I want to pause and see, do we have any questions? Because I could talk to you all day long, but I want to be able to answer your questions as well. Melinda, are you? I don't see any questions in the chat box. Melinda, did you have some questions that you wanted to ask?
Yes. Yes, so I'm going to read the question. Do you hear me?
Yes.
Okay. The question is, how can we address vaccine hesitancy for HPV vaccine in African American parents?
That's a great question. And so I touched on that a little bit, but when I go deeper into it, so I grew up in South Carolina, and I'm only, you know, my grandfather was a sharecropper. So 2 generations removed from sharecropping. So a lot of people don't like talking about this, but when we look at health disparities, it really truly is a direct result from slavery. And part of that conversation has to come in with there has to be trust. And we know, not just based on the Tuskegee experiments, but many times over, there were many things. Look at Henrietta Lacks and what happened to her, and why there's such a big distrust in the Black community. And so you have to gain that trust again. And so when I talk to my own friends and family, they're hesitant to get vaccinated against HPV. And these are people who, when I had my surgery, they were there for me. They cried with me. They prayed for me. They know what I went through. They've met women in my community, but they yet are still hesitant. And so that is a big thing that we need to work on. And, you know, a lot of it is taking the time to effectively communicate and give resources. I have family members and friends who they say, I'm coming to you because I know you know, my child is at this age, the pediatrician is saying they should get the HPV vaccine. What should I do? I have a standard list of resources that I give them. I try not to overwhelm them, and I say, read this, read that. They usually come back with something they found on social media, and I bring in, this is why this is not true. This is why this is an incredible source. And 9 times out of 10, they move forward with getting their child vaccinated. And so communication is key, having empathy, understanding, and not trying to think that's in the past. That's in the past. That has nothing to do with the future. No, it's not that far in the past. So those are things that we have to acknowledge, and those are things that we have to gain trust to work beyond. And it starts with communication and empathy.
Thank you. We have another question. How do we encourage pediatricians to start recommending HPV vaccine as cancer prevention at an early age?
So, you know, the pediatricians had it hard. Parents were reading things on social media and really, you know, like, no, I'm not going to do it. And pediatricians buckled a little bit, and I understand it, but you're the experts. So you have to do what you went to school and what you were trained to do. Be the doctor, be the expert, share the information. Ultimately, the parents are going to make the final decision, but you know that you've done and exhausted everything that you needed to do to make it happen. When my stepdaughter was eligible for the HPV vaccine, you know, we took her to the doctor. And the first thing her pediatrician said, and I loved her pediatrician, wonderful woman, right? She said, oh, you want that? She said, I just don't even ask for it because most parents are against it. I just don't even bring it up. When we were changing my stepdaughter's school, they gave us a form to opt out of the HPV vaccine. Didn't even ask. He just passed over the paper. And I asked why. He said, well, most parents get upset about it. But you missed an opportunity. He didn't know what I was going to think. He just assumed that I was going to be upset about it. And so we have this opportunity to do our jobs. And that means having hard conversations. That means that we may get more no's than we may get yeses, but for that one yes, it will be well worth it. And so for me, pediatricians owe it to the children that they are treating, because they won't see the cancer, right? These kids will grow up and it will happen later, even though we're seeing people younger and younger diagnosed with cervical cancer, right? But it is absolutely up to the pediatricians to educate the parents and make sure at the end of the day that they're not really trying to sway, they're just giving out the information and scheduling it like they would any other vaccine.
Okay, we have another one. Thank you for sharing your story. Prior to getting a hysterectomy, did you consider trying any holistic health recommendations such as herb healing?
I did not, and I'm not opposed to it, but I do believe in chemotherapy and radiation. And I think adding a holistic element, as long as you talk to your care providers, is totally fine. But it really is an individual choice. But for me, it wasn't for me.
Okay, we have another one. What are some of the resources you recommend to share with parents to help them decide to vaccinate?
Really, you know, your pediatrician is going to be the best resource. The HPV Vaccination Roundtable is a powerful tool, but I really love for pediatricians to not only have literature, but also be able to refute any myths that someone has right then and there. And because parents are going to come with what they saw on social media, their cousin, their sister, whomever shared this information, and this is why I shouldn't get my child vaccinated. So I think it's incredibly important for our pediatricians to be armed. I think having videos, you know, and saying, watch this video, emailing later, and I know everyone is pressed for time, and not just the doctor, but the nurse, the front office person, but people are dying. People are dying from HPV-related cancers. So it is just incredibly important to make sure that that information is being shared.
Tamika, next question. Do you get the option of extracting your eggs prior to a complete hysterectomy? Thank you for being so brave and transparent.
So yeah, in 2001, they were able to remove eggs from people, but the technology wasn't there. I also didn't have a lot of time, and it was very costly and not covered by insurance. And I had just received a cancer diagnosis, so it didn't happen for me. It's bittersweet because I've been able to change laws so that fertility in the state of Maryland, where I reside, is covered for adolescent and young adult cancer patients. But it was not. And it has taken a lot of prayer and therapy to be able to move on from that. Yeah, I wish that I would have had that chance, but it wasn't a part of my story, and it's unfortunate. And again, that's another form of a health disparity.
Okay. Thank you for sharing and for your transparency. Back in 2001, when you were diagnosed, were there other options before the hysterectomy? Any second opinions? Thank you for sharing your story.
I had about 10 second opinions, and they all said the same thing. I needed a radical hysterectomy, and I know they were right because when I look at my counterparts with similar diagnosis, they're either not here or they've had a lot of secondary issues, and I haven't had any. So I don't regret the hysterectomy in that sense, but I did. I had a lot of second opinions that took me a lot of years to pay for, and there was one procedure, a radical trachelectomy, that I could have done, but I would have had to get pregnant immediately. And with my tumor, they didn't even know if that was going to happen. And I would have had been on bed rest the entire time. But in the end, the hysterectomy is just what seemed like the best way to preserve my life. I wanted to preserve my fertility, but I had to make the choice between babies, future babies, and my life, and I chose my life.
Thank you. How can we address the disparities?
Acknowledging that they exist. This notion of we're all the same, and you know, if someone wants better healthcare, go get a better doctor or go do this and whatever. That's just not how the world works. I think a lot of times people mean good, but they're looking from the lens of their cul-de-sac, meaning that they only see what's happening right in front of them. And so there are a lot of stereotypes and different things happening. You know, I had a job where I did pretty good for myself, but when it came to health benefits, I was either not insured or underinsured. And a lot of people don't even think about people being underinsured. They think about people just having insurance or not having insurance. And so we have to really take that into account and be able to also provide resources. You know, for me, one of the things that I like to do for patients now is make sure that I have resources. It could be something like Family Reach that helps pay for cancer, any cancer needs that someone newly diagnosed with cancer might have. And so I just need people to acknowledge that there are health disparities and be a part of the change of closing that health disparities gap. And that they're unique needs from different cultures and ethnicities, right? It's not a, you know, one size fit all fix for everything.
Thank you. We have another question here. Okay, can you talk about being in the uncertain place of getting positive HPV results, but being told by your doctor, let's wait and see what happens? Some women get very concerned at the time and regret not getting vaccinated for HPV when they were younger.
Yeah, so when I was diagnosed in 2001, there wasn't a vaccine or an HPV test, but they know that I most likely had HPV 18 or 16. We do hear a lot from people who were diagnosed with HPV, and they're terrified, they're scared, and they wonder if, they should get vaccinated. And again, it's a personal choice, but we know that when you get vaccinated against HPV, you're not only protecting yourself from cervical cancer and genital warts, but several other different kinds of cancer like anal, vulvar, oral pharyngeal. I know I'm missing some, what else am I missing? I'm missing some other cancer, vaginal cancer. I don't know if I said that. But it's important because you can protect yourself against all of them, and better protection is better than no protection at all.
What suggestions do you have for nurses to educate parents before their children are at the age to be vaccinated? How should we, quote, plant the seed?
So I think you should do it as early as possible so that when the time comes that they actually do need to be vaccinated, it's not an abrupt, like, where did this come from? Like, it's a conversation that's already started. If someone's coming in and they're bringing their 6-year-old, well, at 9 they can get the HPV vaccine, or you can do it 11 and 12, so that you're having that conversation. And I love when someone reaches out to me, a parent, and they said, I took so-and-so in for their 10-year appointment, and they told me that, the HPV vaccine is one of the vaccines that will be upcoming, literally just rolling it into the list of vaccines that are available for that age timeline. And so, yeah, bring the conversation up, start it early.
Okay. There are folks that are hesitant about HPV vaccine for personal reasons. Aren't there other things we can advocate for, like changing to a nutritious diet and eating more fruits and veggies that promote cervical health, exercising regularly, etc.?
There's a woman who had cervical cancer who wrote this blog called "But I Ate So Much Kale." She ate so much kale, she ran all the marathons, and she still got cervical cancer. Cervical cancer isn't about what we eat. It's about being exposed to the human papillomavirus, which there are over 100 different strains of the virus. And so it's important to be vaccinated against it. You can eat all the kale, run all the marathons, and you are still at risk for HPV-related cancers. So it's best to be vaccinated against HPV-related cancers.
What about women not having Pap smears after age 65 annually with the history of positive HPV followed by subsequent negative results?
I think it's important, especially for women of color, particularly Black women, to still get screened, because there is data that supports that women who are 65 and up have had issues with cervical cancer. So it's important that they're still getting screened. I also think this is another reason why it's important to have a primary care physician and an OBGYN, so that you are able to have shared decision makings. Guidelines are just that, guidelines. And your individual care should be when you have a conversation and be regularly screened with your physician.
How effective is the vaccine to prevent cervical cancer?
It's very effective. There have been over 1 million doses that have been given out worldwide, and we're seeing in places like Rwanda and Australia where their incidence of cervical cancer has drastically declined. And we should be seeing something like that in the United States, where we have great screening, but people are not getting vaccinated. And it is tragic because people, especially young people, are still dying from cervical cancer.
The change in Pap smear frequency recommendations causes a lot of confusion. Can you clarify the current guidelines?
It absolutely causes a lot of confusion. It confuses me. You know, again, this is where shared decision making is extremely important. And so if you have a cervix, you need to get screened. How often you get screened is something you need to discuss with your doctor.
In an ideal world, what do you think needs to happen to increase HPV vaccine uptake?
I think when people see more of these stories of people who've been impacted by cervical cancer, not just people like me who on the outside look fine, but people who are living with ostomies and urostomies, and people who have their quality of life has drastically changed. People who unfortunately lose their lives, I think people will be getting screened. Unlike other cancers like breast cancer, these stories aren't out there. And I think the more that these real impactful stories get out there, people will want not only for themselves, but their children to be screened.
Some doctors say they want to delay HPV vaccine because they want to be able to talk to the kids about why they're getting it. What can we say to those doctors?
Until that happens, you have to have a conversation with parents. And again, it's a difficult conversation, especially if you go into it knowing that a parent is anti the HPV vaccine, but it's an absolute necessary conversation that needs to be had.
What is the biggest reason you hear why parents don't want to vaccinate their kids?
That it will cause them to have ovarian failure, be infertile, that they will have some neurological disease or ultimately die. But the same could be said about cervical cancer, and most of those things have been unfounded.
Are there side effects of the vaccine?
You know, mostly a painful pain at the injection site, as with any other vaccine. There have been some people who have gotten dizzy and needed to sit down for a while. This vaccine burns more than most vaccines.
I have one more. There are still some pediatricians who do not recommend HPV vaccine until later than 11 or 12. What would be the best recommendations to recommend to them?
I mean, the science all says that, you know, young people at 11 and 12 is the best time for them to get vaccinated against HPV, because we know that young people are being sexually active earlier and earlier. And so the best protection that you can get against the HPV vaccine is before someone is exposed to HPV, meaning before they're sexually active.
What are the signs of cervical cancer? Are there any symptoms women typically have?
Sure, there are signs of cervical cancer, but in most cases you won't know, which is again why screening and vaccinating are incredibly important. It could be, you know, leg cramps, bloating, period pain, sex, blood in between sex, and these are things that could happen for any said reason. So your body whispers, so you have to be screened, but you also, your best chance of being protected is getting vaccinated.
We have a few more questions. Okay. Why is screening at an all-time low, especially if more people are aware of cervical cancer?
Well, right now it's because everything was shut down because of the global pandemic. And outside of the pandemic, no one has ever woken up and said, it's Pap Day. Oh my God, I'm so excited for Pap Day. It's such a fun day. You know, getting screened for cervical cancer isn't a fun thing. You have to put your legs in stirrups. It's highly invasive. And people just don't like doing it, but it's absolutely something that we should be doing. And we should be experienced young women for that experience, because it could be, you know, traumatic.
Do you experience bias when seeking cancer care and treatment? How can healthcare professionals ensure they provide culturally competent care to patients experiencing cervical cancer treatment?
Absolutely. I've had people kind of dismiss me because they just assume that, well, you should do this because that is going to be very costly. Give me all my options, whether I can afford it or not. You don't know what I can raise. I can have a fish dinner. I can, have a collection plate taken up or whatever. It doesn't matter. Like, give me every available resource and I'll make the best decision based on that. There's a lot of medical bias and that needs to change.
Okay. Why did you start sharing your story?
Because I wanted to let people know what happened to me. I couldn't believe what happened to me. And I would see things happening for other cancers. And I was like, where's my ribbon? Where's my t-shirt? Where's my ink pen, my water bottle? Where's my 5K? And everything that I would read about cervical cancer was very negative. And I wasn't going to have this negative cloud follow me for the rest of my life. I had survived this thing and I wanted to celebrate that I had survived it. And I didn't want to be alone. I knew I couldn't have been alone.
How did you get past the stigma?
Some days I don't think I've gotten past it. I think I just know how to navigate it better. I think that, there's always going to be somewhat of a stigma, but I just don't care in the sense anymore. Maybe it's because I'm married. My husband knows, who I am, my worth. The same with my stepdaughter, who I've raised since I've been 9. And there are a lot of women who need me. And so I can't focus on the stigma.
You're right. You hear about breast cancer all the time, but not cervical. How is your organization raising awareness?
We're very active on social media. Outside of the pandemic, we're active out in real life in communities and sharing our stories. We have Cervivor ambassadors all over the world, from the United States to Kenya to Ireland to places in Europe that I've never heard of. And we are making sure that we're sharing our stories and we're leaving our advocacy footprint. We want people to know that below the belt cancers matter too.
How can healthcare professionals help decrease stigma, which leads to increased vaccinations?
Don't be biased when people come in to get screened. One time I had a doctor tell me, this was pre being diagnosed for cervical cancer, your belly's so big, if you were pregnant, you wouldn't know. I immediately put my clothes back on and I didn't want to be screened because I felt fat shamed. On the other hand, you want people, if someone comes back positive for HPV, you don't want to say, well, you must have been promiscuous. This is the reason why it happened to you. So those type of biases and stereotypes need to change. When we're giving out literature, I don't even know why it still says one of the risk factors is because of multiple sex partners, because you also can have one sex partner and get an HPV cancer diagnosis. So that needs to change immediately.
How can we be better at closing the gap?
Take a page out of breast cancer and colon cancer and start talking to people, making sure they're aware. I asked my friends and family, have you been screened for cervical cancer? We asked if people have had their mammogram, if they've been screened for breast cancer. Why don't we do the same with our loved ones and ask that? When, a provider, if it's a general practitioner, are you asking these things or are you just assuming? Do you have an OBGYN? Do you have a gynecologic oncologist? Not areas will have those. Are there nurse practitioners? Again, not all areas will have this, but knowledge is power. And so I think it really is important for questions to be asked and information to be disseminated in a loving way with kindness.
Thank you, Tamika. We got a lot of great questions, and I just want to let the audience know we do have a few more minutes for any additional questions if there are any. So I'll give a few more minutes if anyone has any questions. Also, again, please feel free to continue to submit your questions for the last couple of minutes. And if we don't, I don't think we have any incoming anymore. All right, so many thanks again to our speaker, Tamika Felder, as well as to Kareem Amadeo, who is handling the technical back ends of the program, and to all of you who have joined us today. A reminder that you will receive a link to a post-program evaluation. Your feedback is important, so please take the time to complete. Certificates of completion will be sent via the email you provide on the evaluation, so make sure that it's correct and should be received in about 1 week. A calendar of the partnership's upcoming virtual programs can be found at www.pmch.org under the Professional Education tab, and we also offer on-demand recordings. Also, I would like to thank and acknowledge the White Hill Foundation for funding today's event and speak about fundings for today's event. Also, you can access HPV resources on our partnership website. So Tamika, do you have any last words before we conclude?
Please watch that video that's in the chat, and I appreciate you all so much for giving me a platform to share my story. Thank you so much.
Thank you, Tamika. One more question before I know I said that a few times, but since it's the last one. All right, any suggestions for making the vaccine more of a religious norm for those who are hesitant to have their children vaccinated against HPV?
I don't have an answer for that. I'm so sorry.
Okay, thank you. And just again, I want to remind that we did put the link in the chat, so if you would like to review the video link that Tamika did refer to, it is in the chat for your references. Again, thank you so much, Tamika.
Thank you so much for having me. It was my pleasure.
Thank you, everyone.